I came back to Maine because that's where home is for me, and I've known that my whole life. So even when I was training and living in these other places for years, it was always with the goal of coming back to Maine in the back of my mind, in large part because my family has provided orthopedic care to people in Maine for decades now, and that was something that I wanted to be a part of.
I was very excited about being able to come back and work here at MaineGeneral, not just because it's a great hospital system, but also because there are great people here. But what really meant a lot to me was to be able to come back where I grew up, see people I knew, and be able to help these people and take care of them. So in our sports medicine practice, we take care of everyone in the community, whether it's our preteen or teenage local athletes, collegiate athletes, folks just trying to stay active and healthy, or folks who have had an injury acutely and need our help and surgical services. That can involve many different routes. That could be being evaluated and treated initially by their athletic trainer, some of our very knowledgeable primary care sports medicine physicians, or ultimately potentially needing a surgical intervention by ourselves at the orthopedic sports medicine practice.
Patient care is provided through a cohesive team here, where we take pride in knowing that we're all on the same page when it comes to patient care and access, and that's one of the best parts about the MaineGeneral experience in my mind is that you're really nestled within this team of providers that are all aware of where you are on that journey of your care.
Although a patient in one room and the room right next to them may have the same exact injury, it's their unique set of circumstances that I take into account to figure out what the best plan of care is going to be for them and to get them back to everything they'd like to do moving forward. When a patient comes to me with an injury that requires surgery, we have a detailed discussion about what their goals and aims are, things they'd like to get back to, whether it be running, skiing, sports, and we make sure we're able to achieve that. Surgery is just the beginning of the process, and we go through this journey together to ensure that they're able to do that, whether it takes 3 months or sometimes a year. And we have a well-integrated team that helps get people back to where they'd like to be.
I think it's important to note that we treat each patient individually, and we tailor their specific care to the nature of their injury. This often means no surgery, and that is totally fine by us. Other times people require surgery, which we are happy to provide as well.
I think several things set our sports medicine practice apart from some of the other practices in the broader area. We're a comprehensive practice. There's not a single sports medicine surgery that we don't provide, whether it be in the hip, the shoulder, the knee, or the elbow. We're an innovative practice, which I'm really excited about. We do some of the more common surgeries that most people have heard of, like ACL reconstruction or rotator cuff repair, but we're also introducing a lot of newer technologies that are unique to the state of Maine, like cartilage restoration surgery, and eventually surgeries like ACL repair.
We provide the same services that you would find at any top tier 1 academic medical center in the United States, and we're doing it here in Augusta, and we're doing it within the MaineGeneral organization, which is smaller and more nimble, and I think therefore it gives us the ability to bring the most up-to-date services to our patients.
I knew when I started my sports medicine practice that I wanted to create a comprehensive practice, something that encompassed everything in sports medicine, so that no matter who came to saw me, I'd be able to take care of their issue, and also to create something that was innovative as well. And it meant the world to me to be able to establish this practice in my hometown where I grew up.
I think I'm most proud of the fact that Maine General Sports Medicine is, in my mind, without question, the best sports medicine program in the state of Maine. Both operatively and non-operatively, we provide things that nobody else in this state provides. And to be a part of that and to provide this level of care for Mainers, of which I'm one, makes me really proud.